Hello, my dear friends. Dr. Dhawan here, and we at Doctor's whole team wish you all good luck for the examination. And just remember a couple of things. Number one, you have got very good knowledge to really get a good score in the examination. Number two, out of 5 blocks, 2 are always tougher. Do not worry about them, and do not let that tough block affect your remaining 3 blocks. Third thing, which is very important, is keep that time in your mind. Actually, a lot of people waste a lot of time in the first few questions, then last few questions are actually done in a faster way. Number four, be a bit aggressive in the examination. If you have idea about one choice, two choices, you have to attempt it. Playing too defensive would not be really good idea. But just make sure that you have this concept clear in your mind that whatever you are feeling about tough question, majority of students are feeling the same thing. Who actually does well on the exam day is the person who keeps walking with full force, full strength further till the last question of the exam is over. And just make sure one thing: simple questions, we do more silly mistakes. Read all the 4 choices, then only make up your mind to mark the right choice, and do not revisit those questions again and again. And in the clinical vignettes, always go for the common diagnosis, always go for the common approaches we actually use for the management also, because most of the times they are having a lot of ornamentally beautiful question which is having a lot of rare symptom also written in addition to the common symptoms. Do not change your answer for those rare symptoms written over there if the main theme of the clinical vignette is matching your concept over there. So I wish you good luck from each and every member of our team. We pray for your success. We know you will excel in the examination. Have faith, have confidence, move forward.
Thank you so much, sir. Lovely words out there. I would also like to wish all of you lots of good luck and all the best for the exam that's finally happening. Keep calm, keep confidence in your preparation. Don't let anxiety take over this very important day that is tomorrow, because it is a day that you will be going through the last 5 years PYQs. You might just run through some important images, but don't let anxiety take that away from you. In tomorrow's day, you wake up around the same time that you will be waking up on Sunday, so that you set your circadian rhythm in such a way that you can be fresh on Sunday. Attempt maybe two question papers from last and the before that paper in the slot tomorrow, which is your exam on Sunday, so that your mind is used to attempting questions during that time. Make sure you see questions from the last 5 years papers, all important questions, all recalls, and a few important images. That's it for the day tomorrow. Sleep in time, wake up fresh on Sunday, and you are all set for the exam. Just don't get worried. Keep faith in yourself, and that's all that is required. Do not, when you're sitting in the exam hall, as sir has already mentioned, read all the questions properly. But in the simple ones, do not overthink. And in the more difficult ones, do not underthink. Give each question respect, and you'll be through it. All the best.
Thank you so much, ma'am. Hi, everyone. I'm Dr. Sandeep Sharma. You're at Pediatric faculty. So you are all smart people. I always say, you know better than me, better than any of us. This is time for you to just focus, cut out the noise. Last day before the exam, just look at the weak areas. In pediatrics, there are certain areas which are often asked. So pediatric epilepsies, have a look at the milestones. Everyone forgets them. You may or may not get a question, but if it comes, you should be ready mentally. At least you will have that confidence going into the exam. Lysosomal storage disorders, very frequently asked. Vaccines, especially the latest vaccines, the latest changes, fractional IPV and open vial policy. Just have a look at them. What changes have happened? Revise them and sleep on time. Reach exam hall whenever there will be time based sessions. A few sessions will be tough, a few will be easy. Every third question or every fourth question may look to be tough, but you need to remind yourself constantly that all you need is, after negative marking, 75% or so. Somewhere around that, you get your dream seat, a branch of your choice. Even the topper does not know everything. So you just have to be smart and don't overthink. What Palbi ma'am was also saying, don't overthink. I'll give an example. You're marking. Question number 1 is tough. You thought about it. It's okay. Question number 2, you let it go because you have no idea, because there is negative marking. Question number 3, you were able to rule out 2 options. You must mark it. You must mark it, because there will be almost 50 questions out of 200 where you will be able to rule out 2 options. You have read the topic, but you will be in a dilemma. So follow your heart. Just try to go for the more logical answer. Common sense works in the exam. And lastly, don't overthink. If the question is asking you drug of choice for absence seizure, the answer is valproate, whether it is a child, adolescent, or adult. The answer for juvenile myoclonic epilepsy, ethosuximide not absence seizure, ethosuximide not mentioned, go for valproate. Both of them will not be mentioned in the exam. Examiners do not create controversies. They are generally created by q banks or by guidebooks. And lastly, smile, believe in yourself. You have done mbbs, you have passed your university exams with very little knowledge. You will get through with this as well. You cleared your NEET UG, you will clear your NEET PG, you will get a branch of your choice. Sometimes it comes down to that cool, calculated mind in the exam. So go with a cool, calculated mind. All the very best to you.
Good evening, dear students. To tell you, I believe in multiple destiny theory. That means, let us say we have 10 destinies. If we are remaining in our comfort zone, then we'll get the 10th of the destiny, means we might be having ranks in thousands. But if we have that fire in us, then we'll be the first of the destiny. That means we'll have our rank in hundreds. I also believe in the focus of Arjuna. I tell this story that you should focus not only on the bird, on the eye, but the retina of the eye, so that the rest all blurs up. So focus is very important. Of course, as eminent faculties before me, they have given you a lot of details, and each word is important. This is an exam where you need speed with accuracy, and you need to be aggressive, and you have to take some risk. And common sense is very important. Just don't lose it. And the last moment, you have to go through all your notes. Just skim through pages which you have made, those notes. Have self-confidence, because as Dr. Sandeep mentioned, you have been through MBBS, which has taught you a lot. And keep that confidence in you. Come out with flying colors. Our wishes are always with you. Stay sharp and stay consistent. V for victory.
So, good evening, my dear doctors. So, I will not take much of your time. Only the point which I want to highlight is one is focus, already told by Dr. Rajesh. So, please don't lose your focus till you finish your examination. And second, very important thing is that, which I always say, try to read your question before you start thinking the answer. Okay. So, read before you start thinking, and think before you answer the question. So, all the very best for your upcoming examination. All the very best.
Tutorials, and here I am to tell you, please revise up the image-based section of Dr. Tutorial app in microbiology. That will fetch you around 15 to 20 marks easily if you do that also. Okay. Along with that, yes, the microbiology touches around 25 to 30 questions even. So it's good to revise it in the last minutes. Give it at least 1 to 1.5 hours to revise up your facts, and you will definitely see the result in your exam. Along with that, I like to tell up that if the questions are big and you're having multiple hints in that, so that is good for you actually. Don't be afraid of that. That if it is a case scenario that you get afraid that it is a full screen question and all, so don't be bothered about it. You have studied so much well that you know your exact points. Okay, so don't be bothered for that. And very best of luck from my side. And do tell up your results after the exam. See you.
So, guys, best of luck, and it's going to be your day. Is one very quick suggestion is, if the paper comes very difficult, try to skip those questions which are too difficult. If you find overall paper is looking very difficult, don't over answer the things. But if the paper looks average, then you have to mark the maximum out. You have to take the chance, right? Because there will be a area of 10-20 questions, the gray area, ki should we mark it, should not we mark it, because of the negative marking. So it depends that overall how it is feeling. It's looking complete out of the box, questions are too many there, then the cutoff is going to be less,
So
and in
my
that case you
dearest
have an
students,
opportunity that you might skip some of them. If not, then you have to attempt the maximum, you have to take that call. And you have prepared nicely last 1 year or so, and it is happening after so long. So have faith in yourself. It is ultimately the control on the nerves that is very important, that is very vital in this exam, right? And the things will be recalled. It is all there in your subconscious conscious mind. But the point is how good you are in controlling your nerves. The recall will be more and more better. The things you will be able to interpret it. There will be many interlinked questions will be there. The time limit is also going to be a challenge in such exams. So whenever you see, as rightly said, Sir Sonu said, that whenever there is a very long question, try to read the last line, the options at first, before reading starting the question from the beginning. Because once you see the options, you get an idea. For example, what is the diagnosis of the question, and the options are Guillain-Barré syndrome or something like that. Then you have an idea key in which direction you have to think, what are the buzzwords that you have to search in that question, and that way the things will be easier for you. So wishing you a lot of luck, and we all are praying for you. Hopefully you are going to get the good rank and the desired branch you are looking for. Wish you all the very best.
so my dearest students, this is Dr. Rohit Daniel, your orthopedics faculty. I just want to wish you all the very best for the upcoming NEET exam. I know you have waited for this day for such a long time, and after all those postponements and delays, finally the time has arrived which will define your
Finally, the day is here. My humble request to each of you is, please do not get nervous. Don't get panic. Take a good night's sleep. Go to the examination hall a little bit earlier and walk with a lot of confidence. You'll work very hard for this. So don't let self-doubt come in, and stay very positive during your exam. Guys, our blessings are always with you. So see you on the other side.
So, hello everyone. Hello, dear students. So I wish you good luck for the NEET PG exam that is coming up. Just want to tell you, I'm sure that you would have listened to advices from all the faculties. Just one advice from my side: have good presence of mind. Right from the first question that you're answering till the last question, maintain the same focus and energy level, and stay happy, relaxed. You're going to do well. A bit of anxiety is quite normal. So please don't worry. On behalf of entire Doc Tutorials team, I wish all my dear students good luck for the exam. Thank you.
Hello, my dears. Hi, I don't have anything extra to tell you. Just one thing, trust your preparation. You don't have to be anxious or anything. Even if you're feeling nervous, that is quite normal. Don't start anything new hereafter. Okay, just review the notes that you have done once again and stay calm, cool, confident. And please be positive. Don't think anything negative. Positivity always wins. You have got this, guys. So don't worry. Definitely, you will get through. All the best. And on behalf of Talk Tutorials team, we are wishing you all the best.
Hello, my dearest students. This is Dr. Rohit Daniel, your orthopedics faculty. I just want to wish you all the very best for the upcoming NEET exam. I know you have waited for this day for such a long time, and after all those postponements and delays, finally the time has arrived which will define your future. I know this is an important day, but the thing to remember is that this is just like any other exam. Remember, you have cleared much more tougher exams in your life previously. So this is just another exam, and you can and you will definitely clear NEET as well. So don't worry at all. Keep a clear mind for your exam. All your preparations that you have done for the last several months will definitely help you. All our prayers and well wishers are right there with you. So all the very best. Let's hope that all of you clear the exam with the best marks
for your NEET PG exam. I'm sure you prepared well and you will be doing excellent. Okay, so revise your concepts, attempt maximum questions, and have confidence on yourself. All the very best, guys.
Dr. Rajamendran, your doctoral surgery faculty here. So the long-awaited NEET PG has come finally. So stay motivated, go for exam, cool and without any stress. I'm sure you're all going to get a great rank in this exam. All the best.